Hi there, Yorktown. This is Supervisor Matt Slater coming to you with another update on COVID-19 and its impact in our community. I'm going to go right into the numbers. The last time we reported was yesterday. We had 235 confirmed cases. Today, no new data has been shared with the town of Yorktown, so our number remains the same as it did yesterday. Westchester County has seen an increase of 1,117 confirmed cases, bringing the total to 17,004. The state of New York has seen an increase of 10,621 cases, bringing the total to 159,937. And I want to be clear about some of the data that's being presented to you, the public, our residents. Just so everyone understands. The data that we're getting is being provided by the state of New York through the Department of Health. It's transmitted to the county Department of Health. They then pair it by municipality, and they send to each individual municipality. I received questions about a number of individuals who've resolved. We don't have that information. The data that's being provided to us is the cumulative number, and so I just want everyone to keep that in mind. I don't get statistics about how many of the confirmed cases are hospitalized, how many of the confirmed cases are from a month ago. The information that we're provided is the cumulative number of confirmed cases in the town of Yorktown. So I just wanted to be very clear about that. I'm joined tonight. We have two special guests. I'm joined tonight by Dr. Michael Ford. I'm also joined once again by the president himself, Sergio Esposito of the Yorktown Chamber of Commerce. I really appreciate both of you being here tonight. We just have a couple of governmental updates, and then we're going to talk to Dr. Ford and Sergio about some of the initiatives that they are working on. We got, for folks at home, the John C. Hart Library. Again, it's actually their 100th anniversary this year, which we're very excited about. And at some point, when we are allowed to, we will be celebrating that great milestone. The John C. Hart Library and staff have updated their services, and you can apply for a library card now right online. So you can send an email to the library with your name, address, and phone number to jchart, H-A-R-T, J-C-H-A-R-T, at WLSmail.org. So again, it's J-C-H-A-R-T at WLSmail.org. The Hart Library will process your request and email back your library card number and PIN. The great thing about this is with your library card, you'll be able to access all the library's free online books, and we just invested another $5,000 worth of new ebooks, as well as their audiobooks, music, movies, and more. So while we are continuing on the New York on Pause initiative, our library, which continues to do some great things and continues to function, has provided just another great resource for the town of Yorktown. So make sure you get those library cards. We also have an update from Refuse and Recycling. I'm going to read the update here. During the challenging period that we are going through, even with our reduced workforce, the Refuse and Recycling Department is trying to continue the service of bulk trash collection for Yorktown residents. Nevertheless, our crews are faced with an overwhelming amount of bulk trash. Therefore, we must once again revise the upcoming collection schedule. Section 2, crews began the collection this past Monday, April 6th, and will continue even into next week. Section 3 is going to be rescheduled to start on Monday, April 20th. Please note that the collection of bulk trash in the condominium and apartment complexes has been rescheduled to the following. Complex A will now be on Tuesday, May 5th. Complex B on Wednesday, May 6th. And Complex C on Thursday, May 7th. Section 4 is rescheduled to start on Monday, May 11th. And we're going to provide all this information right on our website, which I strongly, strongly urge our residents to utilize. We put all of the information we get as we get it right on our website, so you don't always have to wait for these updates to get this information, and you can always check back to see if there's any new information provided. So again, revisions to the bulk trash schedule. Section 3 is rescheduled for Monday, April 20th. Complex A, Tuesday, May 5th. Complex B, Wednesday, May 6th. Complex C, Thursday, May 7th. And Section 4 is rescheduled to begin on Monday, May 11th. Next week, April 13th through the 17th, in addition to finishing the bulk trash collection in Section 2, crews in the Refuse and Recycling Department will be picking up leaf bags and tied bundles of branches only on your recycling day. Again, only on your recycling day. Please note that we must limit the collection to no more than 12 leaf bags and 4 bundles of tied branches per household. As a reminder, the organic yard waste facility is open for Yorktown residents to drop off grass clippings, leaves, branches, and logs in their own non-commercial vehicles. And we also want to encourage proper source separation. It's very, very important, and it's part of the required weekly recycling and for bulk trash collections. Everyone can review the rules and regulations in the brochure that was mailed to your homes in February, as well as on the town's website. You can visit yorktownny.org/refuse recycling. Again, we want to, on behalf of the R&R team, who continues to function and who continues to provide a critical service to the residents of our town, we appreciate your patience and understanding. If you do have any questions, you can always reach out to us directly. You can call me directly here at Town Hall. My direct line is 914-962-5722, extension 200. Again, that's 914-962-5722, extension 200. Or you can email me. Again, you can email me any time of night, mslater@yorktownny.org, with all of your questions. We did mention the organic yard, which does remain open, except it will be closed Friday and Saturday because of the holiday weekend. Our parks, as a reminder, active parks remain closed in the town of Yorktown. Passive parks remain open. Again, 40 miles of hiking trails all through Yorktown. It's a great time to consider exploring some of the natural beauty of our town during the current situation. Again, as always, remember to continue to observe your social distancing, something Dr. Ford's going to get into. But again, under the parameters of the New York on pause, solitary exercise is allowed and encouraged. So again, our active parks, so again, that's our playgrounds, our basketball courts, our sports fields, they do remain closed. The passive parks remain open. FDR Park remains open, except again for the basketball courts, sports fields, and playgrounds. Those have been closed as a statewide initiative for the state parks. Again, Easter Sunday is coming up, and a happy Easter to all who are observing, as well as a happy Passover. For those wondering, store closures for Easter Sunday, all grocery stores except for Acme will be closed on Easter Sunday. Acme will be open until 3 p.m. And lastly, as a last reminder, we do have Free Food Friday for our first responders over at Lyle Puente's Meat on Your Bones, Put Meat on Your Bones food truck at the Jefferson Valley Mall. I'm sure, Sergio, you might speak more towards this when you give your update, but again, another great partnership between one of our local businesses, the Jefferson Valley Mall, and the Chamber of Commerce for our first responders, who again just continue to do a terrific job, from our Mohegan firefighters and volunteer ambulance corps to our YVAC and of course our Yorktown Fire Department and Yorktown Police Department. Yesterday we had 2 wonderful people donate KN95 masks for our first responders. So we were able to provide them with a few, frankly, a few hundred combined of these PPE for when they do respond to these emergencies. And again, that's the Yorktown way, how we help each other in these times and step up and and do the right thing for each other. And with that being said, again, it's not on my list, but I do want to remind everyone that tax deadline remains April 30th. We did hear from our Board of Legislators that they are considering legislation that would reduce the late fee and penalties in the month of May to 0.5%, in the month of June to 1%, and from July 1st to July 15th to 1.5%. It is critically important, though, for those who are able to pay their taxes to pay their taxes. We here in the town of Yorktown have frozen all non-COVID related spending, and we just today we're doing rounds of meetings with our department heads to find other areas where we can tighten the belt. And our goal right now is to ensure that we don't have to go into any short-term borrowing to make ends meet. A lot of that is predicated off of the tax collection, which again right now stands at April 30th. And with that being said, I am very excited to welcome Dr. Ford to join us, Dr. Michael Ford. He's a primary care internist with the New York Presbyterian Medical Group, Hudson Valley. He practices out of Sleepy Hollow.
That's correct.
He practices out of Sleepy Hollow and is an assistant attending physician at New York Presbyterian, an assistant professor of medicine. You forgot that note. Yeah. Assistant professor of medicine in the Department of Internal Medicine at Weill Cornell Medicine. So, Dr. Ford, we really appreciate you being here today.
Yeah, I'm happy to be here. Thank you.
To talk to us about what you're seeing as one of our frontliners and provide some information to the public.
Happy to be here, and I'll tell you anything you want to know that I have an answer to.
No, it's great.
Right.
One of the things that I know we wanted to get into, and I mentioned this at my last update to the public. I actually participated in a demo telehealth program, and I know telehealth is something that you were very focused on.
Very focused.
And so, why don't you explain to the folks exactly what telehealth is and how the medical profession is really migrating towards a more telehealth focus, especially during this time?
Absolutely. So a telehealth visit is basically like Skyping with your doctor or using FaceTime. The difference is that we use secure platforms. So we have a two-way video feed that's HIPAA compliant. That's the main difference. It's been around for some years. There's a number of companies that offer the service. And we were using it on a limited basis over the last several years. For example, I had myself set up, and I might do a quick follow-up visit with a patient where it was really just a conversation that we needed to have, and it didn't require a physical exam. A couple months ago, when we started hearing reports of this coronavirus making its way into the United States, that's when things started to change. It occurred to me that when we started seeing cases in New Rochelle, and these people were not traveling to any of the affected countries, that our screening question when patients called our office to make an appointment had become useless. What we were saying when you called up and said, hey, I have a fever and a cough, we'd say, okay, have you been to China? Have you been to Iran? Well, that was no longer a differentiator. And you may not know it, but in an office like mine where we see, say, 20 patients a day, in this season we're going to see 10 people a day who could have COVID-19, and they might have a cold, and they might have pneumonia, and they might have the flu. And so at that point, we got together up here and we said, that's a really big risk. How are we going to mitigate that risk? And the video visit was the idea that we came up with, the idea being, if somebody has symptoms that could be COVID-19, we don't want them coming into the office.
Right, of course.
You know, they're going to traverse society and sit in our waiting room, and this is highly contagious, make other people sick. Can we handle this over a video chat? Say they don't have COVID-19, they've got a cold. Well, what if the person in the waiting room next to them has COVID-19? So,
and you're exposing the person with COVID-19 also to the cold.
That's
and
right.
Vice versa.
So initially we started weeding those people out. So anybody, we called it CCCF, cough, cold, coronavirus, flu clinic, and anybody that called up essentially with symptoms that were referable to the upper or lower respiratory tracts, would get initially shunted to me up here for New York Presbyterian in Westchester and Hudson Valley. But that's a lot of patients.
Right.
And so very quickly, and this is something that's been very interesting about this time, my medical assistant became kind of a scheduler and an IT person, and my office manager did the same. And I'm really proud to say that over the course of 1 week, we got all of our doctors converted over to telehealth. I'd already been doing it, so the reason I could jump in was I already had my account set up.
Right.
So they were able to accelerate that process, and initially we were just using it for the CCCF, but after some time we realized that asymptomatic coronavirus was out there as well.
Right, exactly.
How much risk do we want to put our patients at to see the doctor? And we essentially shut down our offices and switched over
Solely telehealth?
to solely telehealth, at least as the initial visit. We're not, we're still doing some in-person visits. You have to sometimes. Yeah. But when we do them, we want to make sure that we do it in a safe way. So, we'll bring the patient in alone.
Yep.
We'll give proper...
can you tell us any estimate as to how many telehealth patients you see, in a week or so, or a day, or?
That's a hard estimate. Just me or the whole group? There are so many of us doing these visits now, and I've been sort of involved in some other initiatives as well. And now that role has been sort of taken over, most doctors are seeing their own patients. But my partner, Dr. Concharla, I'll look at her schedule, and at this point, it basically looks like her schedule always looked. She's got 20 or 22 patients on it, and they're calling her, and they're doing a video visit for a variety of reasons. Mm-hmm. They're not all, or probably not even most at this point, have CCCF symptoms. They're doing diabetic follow-up, or they're calling with some other new issue, and she's evaluating them.
What do you say to seniors? Because we do have a lot of seniors who are hopefully watching. Yeah. What do you say to seniors who just are a little apprehensive about the emphasis on the technological use of a telehealth visit versus their traditional, person-to-person visit?
Yeah, I can totally understand that. And even on the end, you do need to have a smartphone to do this. And then there's an app. It's NYP On Demand is the app that you download. It's actually been a really, really good adoption. I was afraid on both ends. I think your question has less to do with how can I use the technology and more to do with how can I get that interaction with the doctor that I want. Right. So I was worried about both things. Okay. And from my own perspective, are we going to be able to get patients to successfully use the technology? Because if we can't, this is just going to be a long day every day of not doing visits. Right. And that ended up being very easy for them. We get them onboarded right away. And when it doesn't work, for now, standards are relaxed. We can Skype, we can FaceTime.
So there's other methods.
There are other methods, yeah.
Other than just downloading the NYP On Demand app and going through that.
That's right. We like that because it's secure.
Right. Well, that's the whole thing about it. It's to your point that you said earlier. Yeah. That security is crucial, especially when you're talking about medical issues.
Medical issues. To your other point, or your main point, I think I was concerned as a doctor. How effective will this be? Can I, because my perspective when I'm about to walk into the room is somebody's here with a problem that they want me to solve. I hope I'm going to be able to solve this problem. And the way we go about solving that problem is by doing a history, which is a conversation with a patient. Mm-hmm. We'll do a physical exam. We'll oftentimes then order tests. Tests could be a radiology test or blood tests or a swab. Right. But I quickly... I was just very pleasantly surprised at how much you can get just by looking at a person. You can see a sick person looks like a sick person. Doctors are trained to know this. When you go into residency and you first start presenting a patient that maybe you admitted from the ER to your attending, Matthew Slater is a 37-year-old male who came to the hospital with a cough, and you go through the whole history, and then you get to the physical exam. And if you jump in and say he had regular heart sounds, I listened to his lungs, they'll stop you and they'll say, hold on, what did he look like?
Yeah.
What did he look like when you walked into the room? It's a really, really important thing. I mean, I can diagnose flu just by looking at a person. Really, I don't need a swab to do that. And the other thing that I was reminded of was they tell us that 95% of diagnosis comes from the history, which is that conversation that you have with the patient.
Which you can have over telehealth.
You can, and
person to person.
quite frankly, it's been given short shrift in recent years, and I think we're kind of getting back to it.
That's interesting.
I had a telehealth conference with my orthopedist, and I found it more effective than I had imagined. So it did work out well. I was a little apprehensive in the beginning because, I'm a face-to-face kind of guy. But I got to tell you, it really does work. It's, for everybody out there, the seniors, and, don't be apprehensive about it. It is quite effective.
Yeah. Yeah, thanks for the patient perspective. The other thing we want you people watching to know is we are still seeing patients. We're doing it differently. In yesteryear, I wouldn't have seen a new patient via telehealth. And there are probably some new patient concerns that would not be able to be done via telehealth, but I'm taking many new patients via telehealth. Your other doctors, who may or may not be with New York Presbyterian, are probably doing the same thing. So, just because COVID-19 is here doesn't mean other illnesses have stopped happening. And we want patients out there everywhere to remember that your doctors are still here, and we want to continue to keep up with your chronic conditions, any new concerns that you may have, and we're also doing a lot of COVID-19 stuff.
Yeah, it's a great point. Again, COVID-19 is not the only virus or disease that's out there. I mean, there's other things that people are dealing with, and it's important for folks at home to know that your doctors are still, you can still get to help and address the ailments that you're facing, and that's a great point. So I really do appreciate you sharing all this with our residents. Yeah. Can you talk a bit about, it's been pounded into our heads, social distancing.
Yeah.
How important in the world of COVID-19 is social distancing? Can you provide some insight on that?
I can. I think it's really important, actually, and I think the folks at home can see how we've spaced ourselves here at the table. We've got at least 6 feet between us. So I think if I tell you the science behind it, then it's going to make sense and people will understand why it's important. So viruses like the flu and coronavirus spread via respiratory droplets. And these are particles that come out of your mouth when you cough or when you sneeze, but also when you talk. Mm-hmm. They're coming out of my mouth right now. We can't see them, but they're heavy enough that they don't travel more than 6 feet in the air. And then they hit the ground. And viruses tend to not be very stable when in contact with a surface. In fact, viruses aren't really even alive in that sense. They can only replicate, divide, when they're inside a cell of a host, in this case a human.
Right.
So I could have COVID-19 right now, be asymptomatic, and if I decided I wanted to sit right next to Matthew here, he could come down and become very, very ill in 3 to 5 days. Mm-hmm. And I think that's the point that I want to make is you may be a person who is at risk for a complicated case of coronavirus, meaning you're over 65 years old, you have asthma, you have emphysema, you have diabetes, you have heart disease, or you may be a healthy 28-year-old who thinks you have no risk, but all of us know other people that we care about.
Right,
exactly. And I think all of us, or most of us anyway, generally care about people generally, so that I don't want to walk past an older person with emphysema in the grocery store who I don't know and unwittingly give that person coronavirus. So the social distancing is really, really important. I know we've been taught not to shake hands, to elbow bump. I really think this isn't even the time for that, because you violate the 6 feet to come in an elbow bump.
It's a bizarre. I shake hands with everybody. That's,
Yeah, me too.
It's just kind of what we right. And Now it's a little uncomfortable because now you're just kind of like waving from 6 feet away. Nice to meet you.
Yeah, and I think people
feel
are
rude. I feel
Right?
rude
You don't.
when I
You
do
do.
that. Yeah.
Exactly. You feel rude.
I actually feel rude. I'm
We
like,
feel
I
rude.
don't mean anything. Then I'm
But
apologizing.
You brought up a great point, though, and we talked about this. I've been trying to emphasize this to our residents. Your choices matter, and you could feel perfectly fine, but it doesn't mean you can't inadvertently put somebody else at risk. And folks really need to understand that your choice to engage in a certain activity, even if you're asymptomatic, it could be a perilous choice for somebody else.
Absolutely.
And you have no control over that.
absolutely.
I mean, you have control over the choice, but you have no control
You have no
over...
control over the
Right.
outcome.
Exactly.
At that point. You're absolutely right, and I think the story won't be as simple as here are the at-risk groups, because we've already seen young people
Yeah.
who have
Yeah.
no medical issues become very ill and even die with this disease. So, we're as my boss says, we're building the airplane while we're flying it.
Yeah.
This is the first time in my career, and probably the last, where I'm learning about a new disease in real time from patients. But it gets back to that history that I'm talking about.
Right.
I'm hanging on every word you're telling me because I don't know all the faces of this condition yet, and I'm trying to learn them all.
What do you say, because I said earlier that our passive parks are open, FDR parks open, people are, I understand people, they're getting claustrophobic, they want to get outside. Do you foresee any risks in people, biking on the bike path, going for a jog, going for a walk? Do you foresee any risks with that if they're not, observing the social distancing that we're trying to make them understand?
I really do. In fact, I'm aware of a woman who got COVID-19, and all she has been doing is jogging by herself. So she must have gotten it from somebody else on that path that she passed too close to.
Yeah.
Which is, pretty amazing. It's Easter coming up, so my analogy for the paths, I'm a runner, and where I've always gone in my life to find solitude was these running paths, and they are packed with people now. And so my analogy is, you're like that person who goes to church every Sunday, and then you show up, on Easter and you can't find a seat, and you say, who are all these people?
Yep.
Where did they come from? People are rediscovering the outdoors. That's fantastic. Where I live in Dobbs Ferry, it's like spring break on the Old Croton Aqueduct Trail. If I were out for a walk on a trail that looks like that, I would wear a mask. This is a surgical mask here. If you can get something like this, you go one thing over each ear. There's a little metal piece here that goes over your nose.
Your nose.
I can't feel that on my hand. If I were to put a match there, I wouldn't be able to blow it out. So you know that this thing is going to stop droplets from my mouth getting to somebody else, and vice versa. If you can't find something like this, a scarf or some piece of fabric, a couple layers of it really will
Mitigate the distance.
protect you. Yeah.
Any kind of barrier, I think, right?
Is better than none. I think if you're running or riding a bike, it would be very difficult to.
I was going to ask, though, have you been running? Because I've been going out for runs myself, and I'm realizing how out of shape I am. But are you running with a mask on?
I'm not, and I just don't think you could.
I don't think you can.
Get the oxygen you need. But
agreed.
But then I'll run by people, and I'll give as wide a berth as I can. But sometimes it's not 6 feet, and then I do feel guilty, because when you're running, you're really huffing.
Yeah. Right.
And what are you leaving in your wake?
Yeah, right.
So I'm adjusting my practices. I think that I'm not going to run actually on the trails anymore.
I stopped. I was on the bike on the North County Trailway when this started. I was actually, to your point again. I find a lot of solitude in it as well, and I remember distinctly being going out on the path, and I'm dodging people, and I'm like, this is just not. We're defeating the purpose.
Right. It totally defeats the purpose. What I have found is you can run on city streets now.
Well, that's what I've done. I started.
There's no cars.
Exactly. I'm just running through my neighborhood. My neighbors think it's great. They're all seeing me out there puffing and puffing, but in that setting, I'm not running. There's literally no cars, and I'm not forced to have to dodge people and weave in and out and worry about that 6-foot distance.
Yeah.
And so I think that's important for our folks at home to understand is that if you can, if we think that our parks and our trails are overcrowded, you can walk your neighborhood. You can exercise within your neighborhood.
Absolutely.
And do so in a very safe and intelligent manner.
Yeah, and I think people, it also helps from people getting stir crazy. So if you could do it and you could do it appropriately, it does have some kind of medicinal value to it.
Absolutely.
But Doc, I got a question because I get this a lot, as I roam around a little bit. People come to me and they say, yeah, I've had it. I had it, and they're convinced. So what would you say to someone who came to you with telehealth or in person and said, yeah, I believe I had it?
Yeah, I believe I had it. And we're going to be hearing more and more of that. And in fact, many of these people may be correct about that assumption. But without a test to prove that you had it, it is just an assumption. The other aspect of that is what's implied in that statement is I'm immune now to SARS-CoV-2 and I can't get COVID-19 again because I already had it. And we hope that's true.
Right.
But we don't know that that's true. That's being investigated actively right now. And if it is true, it could be that the immunity isn't a long-lasting immunity. It could be that it wanes very quickly. So in the big scheme of things, there's a few different, there's a continuum here. But on the one end, you've got measles. Okay, so measles is highly, highly contagious and very deadly. But one dose of MMR vaccine leads to 93% of people being immune for life. And that second dose gets that number up to 97%.
Right.
So when you're a child, you get these 2 doses, and we don't see measles except in places where vaccination isn't being practiced. And you keep those antibodies clearly for forever.
My kids have, I've got a 4-year-old and a 7-month-old. I'm well aware of the vaccine schedule.
Right. But then you've got something like Epstein-Barr virus, which causes the majority of cases of mono. And you can get mono again and again and again. Yeah. And the test that I look at to see if you had mono or if you have mono looks at antibodies. So you are making antibodies, but they don't stay with you and or they're not protective neutralizing antibodies. And so we don't know where this SARS-CoV-2 virus is going to be on that. And we hope that people that have been infected are immune, because that's how you reopen your society.
Exactly.
And we hope that immunity is long-lasting. And by the way, the corollary of that is a serum treatment will be more effective if people that are recovering are making neutralizing antibodies.
Right.
So all these things go together, but they're all actively being investigated right now. So I'd urge people that if you know you had it or if you think you had it, still take all the precautions.
Yeah, absolutely. Can I go back to the mask real quick? Because we've gotten a couple of questions about this. The CDC has recommended fabric facial protection if you're going out in the public. We're wearing these around town hall, and all of our town employees have them. Obviously, you came in with one. What's your if you could provide a recommendation, what would you tell people?
I would tell people that I agree with the CDC. First of all, I'd say, who am I not to agree with the CDC? There's some smart people there. But the thing is, if you're keeping your social distancing and somebody has a very violent coughing fit or a sneeze, that 6 feet may end up being 9 feet. And or somebody may walk closer to you and breathe on you, talk to you. So I think any facial protection that you can get is good. These things used to be disposable. I used to throw one out after every patient I used one for. What I do now is I change on the way out of the hospital, and then I keep this in my car.
Yep.
So this is my mask for tomorrow. I'll only change it if it gets torn or if it gets soiled.
Yeah.
But if you can't get one of these, use a scarf. I think it's absolutely important to do that.
Okay. But again, though, that's only if you're in a public place. Like, you're not telling people if you're walking around your house or.
Only if we think somebody may have the
in your house.
coronavirus infection. Yeah.
Okay.
And then, of course, there's other things that we are trying to do to create a space, but depending on the size of the house, that's easier or harder.
Correct.
Which we should talk about, but I will say one other thing about gloves.
Yeah, I was about to ask you about the gloves as
So
well.
gloves, you know, a lot of people are wearing gloves in public, and a lot of people who are working a job are wearing gloves in public, and that may be a good idea for the worker to wear the gloves, and that's really, I think, a policy that their business will set. But I heard an infectious disease expert suggest that we civilians should not be doing that, and I was surprised by that, but the rationale was really good. She said, you know, look, when I'm wearing gloves, and I can tell you this is true because I wear them all the time in the
Right.
hospital, you don't worry about what you touch. But the thing is, you're still going to touch your face
Yep.
with that glove, and that glove can still transmit something off of surface to your face. If you aren't wearing gloves, you're going to be very careful about the things that you touch out in
Yep.
public, and you're going to be more likely to Purell.
Yep.
So the argument against gloves is that, and I think it's actually a pretty good one.
Okay, that's good to know. That's really good to know. And the other one I get is groceries.
Mm-hmm.
How likely? I mean, people have been really utilizing delivery services. So whether you're using a delivery service or you're going to the grocery store, any precautions that you would recommend?
We use Fresh Direct a lot, and it's getting harder and harder to find a delivery slot.
Yeah.
They moved over to contactless delivery, where the guy kind of comes up, rings the doorbell, but you're to understand that you don't go out until the truck is pulling away.
Correct.
So I find that to be pretty safe. You know, you could get very worried about, could somebody have, you know, put coronavirus on
A box.
on the box.
Right.
You know, it doesn't last that long on surfaces. Every surface is different. I think what I would recommend is general hygiene that always keeps people from getting illnesses. You know, is
Perfect.
wash your hands frequently and avoid touching your face. So you carry that box inside, you know, wash your hands after you get it opened. You know, unpack the groceries and wash your hands again.
Yep.
Try not to touch your face. If you're going to the grocery store, some of the grocery stores are lining people up outside, so you know you want to keep your 6 feet in that line and hopefully wear something,
Some type of facial protection.
some type of facial protection.
Yep.
But no matter where you are, I think I've seen people being pretty good about this. You know,
Yeah.
really keeping a lot of distance and space between each other, and I think it's just very important to maintain that. We've stopped bringing the kids with us on errands.
Yep.
It makes life harder.
Yep.
You have small kids, I have small kids, so you can't leave them in the car, you know,
Right.
for that long. And so, you know, yesterday my wife wanted to go to Chico's, but basically, you know, we had to wait for me to get home
So that you can be
so
home.
that
Yeah.
so that she could go to Chico's without the kids.
Right.
So these are the things that I would focus on. Minimize the number of people that are going out when you do that, and then try to stock up.
Yeah.
You know, think about what foods, what medicines you're going to need for the next 2 weeks.
Right. The long term.
Really buy more than less, and it limits your exposure out there.
And then that's great. And then the last question I had for you, we understand that that there's a field hospital over at New York
Yeah.
Pres Hudson Valley Hospital Center right in
That's right.
Peekskill.
That's
Could
right.
you share with us what the goal is there and what
Yeah.
the plan is?
Yeah, so we're anticipating a surge in the ER, which hasn't arrived yet as not definitionally. Now, the ER is very busy, but we're anticipating a surge where the ER can't actually handle all the patients that are coming. And so what we want to use these tents for, and the other New York Presbyterian locations in the city, Queens and Brooklyn have them too, all of them erected sort of just adjacent to the ERs, is we want to offload the ER. So they're being staffed with doctors, nurses, and we want to take the people that are, you know, not as sick into that tent. We want to basically evaluate them there and triage them there.
Right.
Do a full medical evaluation and save the beds. And there's other important equipment in the ER that we can't, that you only have in the ER. So telemetry, which is this constant heart monitoring,
Yep.
is something that we have in the ER, and that's something we kind of need to reserve for the patients who need it.
Yep.
But if a patient who doesn't need it is in a bed where it is and nobody else is going to get it, So that's the goal. So right now the tent hasn't been terribly busy, but we've not taken it down because
Right. We continue to see the numbers every day. I understand today's numbers showed frankly, I find it a little bizarre because we had we rate the bar on deaths statewide was increased.
Yes.
We had yesterday was our deadliest day.
yes, that's right.
But we're also seeing drastically less hospital admissions, and we're seeing, my understanding is we're seeing more, people being released from the hospitals. So are we at that plateau? I can't, it doesn't seem to make too much sense because we're saying,
Right.
great, we're hearing good news over here, but we're
And then
hearing
bad news over
terrible
here.
news over here. What do you make of that?
So I think that I think those two can be squared. I think that the deaths are those people dying today or yesterday were hospital admissions, say 2 or 3 weeks ago, and so the two are going to. There's going to be a lag. So and so if we're hitting a plateau in hospital admissions, we would expect that then several weeks down the road we're at least plateauing in the number of deaths per day that we're getting. And we think we're hitting a plateau, that we're
Right.
stabilizing in hospital admissions. I think everybody wants to be cautious about that because it's been for about 2 days, and is this real?
Yeah, right, exactly.
Or is it just a blip?
Right.
And are we still actually on the way up? So I think that's how you square those
Okay,
two things.
makes sense.
The number of deaths is terrible. On a scale that I've never seen,
Yeah.
and hope never to see again.
Yeah.
So it's you hope you see those coming down in 2 weeks.
Yeah. Well, Dr. Ford, I can't thank you enough for your time and your insight on this terrible ordeal that our community is going through. But I think our residents really appreciate the information that you provided. And I can tell you that, just having the conversation, I think Sergio and I and those watching really appreciate, the information you provided us. So thank you so much for coming down.
Well, thanks for the opportunity, and thanks for what you guys are doing. Running a town is. I got to overhear some stuff,
Yeah.
and what you're talking. There's a lot going on there, and there's a lot of challenges that we're all facing. And we're all facing these things more collectively, I think, even though we're so far apart. And so it's an interesting time, and we'll get through it together.
Yeah, absolutely. We absolutely will get through it
Yeah.
together. I appreciate it. Mr. President, Mr. Sergio Esposito, just wanted to provide just a quick recap on some of the small business initiatives that you've been following. You want to provide just a couple of quick points on that?
Sure. We received some clarity for the seniors on the rebate check. There were a couple of unknowns. One of them was if you hadn't filed your taxes, will you be getting a rebate check? The answer is yes. The clarity that I got from the state is that they are working with Social Security, and that's how they're going to be delivering checks to you, and how they're determining where you are in the spectrum of whether you're below the threshold to receive the check. Another question about the program was if you don't have direct deposit, how is that going to be handled? There are going to be paper checks. From what I understand, the rebate is going to be going out within about a week. Of course, don't hold me to it. If you don't have direct deposit set up, there will be a portal, which hasn't been set up yet, where you can report the address and your banking information securely for a direct deposit check. The direct deposit checks are going to be going out quicker. And then the following week, supposedly, there will be paper checks for those people who do not have direct deposit information on account with the IRS. Lastly, there was a question about the $500 rebate portion for children. And originally it was 18 and under, but it is now 17 and under. And it says no children 17 and older are not eligible for the $500 per child tax credit. if your child worked and filed even an informational return last year, let's say they had like a part-time job, they would be entitled to that $1,200 tax credit as well, just like an adult would be. But, they would have to file taxes. And it's not too late to file an informational tax return for your child if they did work, even though they received, I believe it's less than $5,000, you really don't have to file. So those are a couple of the questions that we received about that, and I hope that clears things up. Secondly, I know that the Paycheck Protection Program is off to a rocky start. It is still invaluable. To date, I believe $100 billion in money has been put into local businesses. One thing to understand is that I wish I could tell you of a process that is uniform across the entire spectrum, but in the private sector, every bank is handling it differently. And so you have to check with your banking institution for their process. I know some banks have been slower on the uptake to get your application in. Some banks require that you fill out a paper application. I know the supervisor had.
Yeah, we had a few people reach out about this as well, and thankfully you were able to provide that insight that it's up to the individual banks. It's not standard across the board, the process. So for those who did reach out, you have to check with your individual banks and follow their individual process.
And another important thing to understand is that each bank is allocated a certain amount of money that they can loan out. It's not just like this $350 billion fund, and every bank is just drawing from that fund. Banks are allocated a certain portion, from what I understand. So if your bank hasn't started yet, or you haven't gotten your application in, and your bank is slow on the uptake, it's okay, because that bank has a certain amount of money that they have that they can loan out from the government. Get those applications in as soon as possible. I know it's frustrating, but it will help us, and it will help us recover more quickly. I'm optimistic. I know I saw a number this morning, Doc, that I believe it was New York, and they said that 25,000 people have been cured or recovered from the COVID-19, which, is a little positivity. I mean, the deaths are staggering, but, a little positive news is always welcome, especially now.
I agree.
So that's the story with the PPP. I know today that the Senate was trying to increase the portion of the PPP by another $250 billion. There are some issues. Several weeks ago, I put out a list of all our senators, and I'm asking everyone to be a small business Main Street advocate. Help the chamber out. We've been fighting for you guys. And just send every senator an email. You got time on your hands? Great. Send them all an email. Tell them it's from me. Not that they'll know who I am, but just let's get the word out. Let's let them know that we need this, and the political wrangling is just really, no one has any stomach for it right now.
Yep. Agreed.
I understand that there are a couple of banks that have stopped taking applications. From what I understand, there's a pause. I'm not going to mention any banks' names, but I do have a call into these institutions to kind of lobby for us here in Yorktown. I don't know how far I'll get, but I am trying for you. As far as the chamber goes, I'm out and about. I maintain my social distancing. We have a ton of businesses that are still open for business. You'll see my videos all over the place on Facebook. The chamber has a list in conjunction with the town. This week, it's coming out in the Yorktown News, and this is the Examiner News. It's a updated list of businesses that are open, their contact information, whether they do takeout. It's not just restaurants. We feel that other businesses are still around and they need your patronage. So you could look for it. I always get yelled at. Tommy says I got to hold it up longer. All right. And so you could also go to our website, yorktownchamber.org, and you could see an updated list on a daily basis. Other than that, the supervisor has asked the chamber to help him in putting together a task force for Main Street businesses and for our economy. Our economy will bounce back. I'm very optimistic. I always have been. And the supervisor is putting a team together that it has no boundaries. And it's going to be a very talented team. and we're going to come up with some initiatives that we can implement as soon as, things start to open up a little. I know as far as the chamber goes, is we had our Spring Fest that we postponed, and I'm hoping that at the very earliest possible moment, when it's safe, we will have our Spring Fest, and we'll call it a COVID comeback.
That's it.
Right.
COVID comeback.
Mr. Supervisor?
I love it. It's good. Thank you, Sergio. I appreciate it. Yeah, the Reboot Yorktown Task Force, I was actually on the phone with County Legislator Gashi. I think he's going to be joining us as well. So we're bringing in a real strong team to take a look at different things that we can do here on the local level. Again, we can only control what happens within the four walls of Yorktown, but just to assure everybody at home that we have all intentions of doing that. And again, I want to thank Dr. Ford. I want to thank Sergio. Both of you, again, providing incredible information for our community. I want to wish everyone, once again, a happy Passover and a happy Easter. And as always, if we have new information, we will continue to provide it to you once it is verified. With that being said, stay safe, stay healthy, and we'll see you soon. Thanks so much.